Hello dear patients. Today we are going to review the case presented on the picture. This is a scar on penis during condylomas of HPV of 31st and 59th types. The patient came to the clinic with a scar on penis, and around it there was a relapse of condylomas acuminatus. What happened to this patient? First of all, condylomas acuminatus started to appear. He didn't want to treat them, he didn't want to do any diagnostics. He decided to remove them in one of famous network clinics of laser medicine. Probably they remove warts and some other neoplasms well, but penis is quite a specific thing, particularly when young girls are employed, who don't have experience in such manipulations. They buy some modern lasers. However, any equipment in the hands of some animals who jump on the trees leads to unpleasant consequences, and this happened here. As a result of condylomas removal, quite a large scar formed in this young man. Although, as I said, condyloma was not so big, but in incompetent hands anything is possible, and expensive equipment doesn't guarantee the fact that this would be done well, as the doctor's experience is important, and the way he works, he can work well with face but not so good with sexual organs, and vice versa. So a removal was done for this patient, and the scar formed as a result. It obstructed during sexual contacts. It hurts. He used a lot of well-advertised ointments, but it was all useless. This is not surprising, as ointments cannot solve the issue with scars. The favorite activity of Russians is to use ointment of some kind and to take some tablets. I know it very well. I call the doctors who prescribe tablets pill-preferring doctors when they use only it. The same doctors who prescribe different ointments can be possibly called doctors painters. So what doctors painters did was unsuccessful, so he understood that something had to be done with his scar, and the presence of condyloma is not good. First of all, diagnostics was done for him. It included PCR for 21 types of human papillomavirus. As a result of it, as I said, HPV of 31st and 59th types was found. Immunogram was taken, and the classic antiviral therapy was done based on immunogram and typing of HPV. We have several videos about treatment of HPV on our channel, you can watch them. So here you cannot prescribe anything just by a rule of thumb, as pill-preferring doctors do. I'm sorry, I'm used to call them like that. So what to do with condylomas? Condylomas have to be removed. They were removed by radiowave method. As the patient has tendency to formation of scars, the scars were superficially removed, and we didn't note them. A classic influence was done for the scar. It contained freezing of scar by liquid nitrogen, cryotherapy with combination of hormones injection into scar, hormonal injections that are a classic therapy of scars. As a result of that, this scar diminished approximately 3.5 times. Pains disappeared at rest and during sex, and it was quite satisfactory for the patient. What I'd like to say is that you shouldn't go to doctors who specialize on cosmetology for removal of neoplasms from sexual organs. This is at least stupid, as cosmetologists should not do such things, and this is indicated by our particular case. You should consult doctors who specialize on sexual organs, and this would be the best solution in this situation. If it is necessary to remove any neoplasms in the area of sexual organs, you can consult our paid medical center or dermatovenerologic dispensary in Moscow. We have experienced specialists who do removal of such neoplasms. We are waiting for you in our clinic. Please subscribe to our channels on YouTube and Instagram. Thank you for your attention.